When you hear the word birth control, what's the first thing that comes to mind? We asked a few people from the Lauvette team, and here's what they said.
I think those are methods to prevent pregnancy like condoms and birth control pills.
I learned it first during high school. It meant for family planning.
For me, contraceptives are tools for responsible adulting, especially with the current economy today. Kasi mahirap mag-anak ngayon, so mahal ang mga bilihin na.
Those are all valid answers. But with just a few seconds to respond, it's natural that these are the first things people think of. However, birth control covers a lot more, and understanding them better can help you choose what fits your life best. Hi, I'm Penny, and welcome to Clitical Thinking, where sexual health, pleasure, and real education come together so you can make informed choices with confidence. Clitical Thinking reflects Lauvette's commitment to modern sexual health and wellness education that's accessible and available to everybody. This episode is brought to you by Lauvette, the leading sexual health and wellness store in the Philippines. If you'd like to explore our full range of love toys and educational resources, visit lauvette.ph or check the links in the description. What is birth control? Birth control, also known as contraceptives, refers to the methods or devices that help prevent pregnancy. Birth control comes with many benefits. Number 1, they help prevent unintended pregnancies, which can help reduce the costs and pressures of raising children too soon. Number 2, they help couples plan when to have children and manage the timing of each pregnancy so it aligns with their budget and goals. Some methods can help to reduce the risk of sexually transmitted infections or STIs. However, protection against STIs is mainly provided by the male and female condoms. So how does birth control work? Different methods work in different ways, and we'll go through them one by one in the video later. But in general, contraceptives help by 1. Stopping sperm from reaching the egg. Number 2. Preventing the ovary from releasing the egg. Number 3. Reducing sperm movement so it can't reach the egg. Number 4. Thickening cervical mucus so sperm can pass through easily. Number 5. Making the uterus less ready for a fertilized egg to attach. Types of birth control. Now that we've covered the basics of birth control, let's look at your options. We'll go from the least effective to the most effective methods. And as always, all the sources and data we used will be in the description box. Natural methods. Natural methods don't involve hormones, medications, or devices. Their focus is tracking your body and making choices based on your fertile days. It comes in 2 types. First is the fertility awareness method, which relies on observing physical indicators to determine your fertile window. Fertility awareness methods include 1. Rhythm method. 2. Cervical mucus method. And number 3. Basal body temperature method. The rhythm method predicts your fertile days by tracking the length of your menstrual cycle. To do this, you'll need to record your cycle for at least 6 months. The cycle starts on your day 1 of bleeding and ends the day before your next period. After tracking your cycle for 6 months, check the data. Find the shortest cycle, find your shortest cycle, and subtract 18 to determine your first fertile day. Next, find your longest cycle and subtract 11 to identify your last fertile day. This gives you your estimated fertile window. For example, let's say your shortest cycle is 25 days. To find the first fertile day, subtract 18 from your shortest cycle. So 25 minus 18 equals 7. This means your fertile window starts on the 7th day of your cycle. Next, let's look at your longest cycle. If your longest cycle is 31 days, subtract 11. 31 minus 11 equals 20. This means your fertile window ends on the 20th day of your cycle. So in this example, your fertile window starts on day 7 and ends on the day 20. Once you figure this out, you can plan around it. That could mean avoiding sex during that time if you're not trying to get pregnant, or timing it there when you're trying to conceive. Now, let's talk about cervical mucus method. For this one, you'll observe your vaginal discharge. When you're in your fertile days, the discharge is usually clear, slippery, and stretchy. On non-fertile days, it's often thicker and creamy. There may be very little or no discharge. Then we have the basal body temperature method, or BBT. For this one, you'll need a special thermometer that shows 2 decimal places. This helps you to get more accurate readings. BBT means checking your lowest body temperature when you're fully at rest. Your temperature changes throughout your cycle because of hormones. It's usually a little lower before ovulation. Then it rises after ovulation. To do this method, take your temperature first thing in the morning, right after you wake up. Try to measure it at the same time every day, and make sure you've had at least 3 to 4 hours of uninterrupted sleep. Start tracking on the first day of your period and keep recording it consistently so you can see the pattern over time. In terms of effectiveness, fertility awareness methods are about 77% to 98% effective. According to Planned Parenthood, using more than one method together can make them even more reliable. However, this method may not work for people with irregular cycles, since the pattern can be harder to predict. Now, there's another natural method you can use. And this time, you don't need to track your cycle. This is called the withdrawal method, commonly known as pulling out. With this method, the male partner withdraws the penis before ejaculation, so sperm does not enter the vagina and reach the egg. What's great about the withdrawal method is that it's free. It doesn't have side effects, and the couple can still enjoy a more natural ejaculation. However, its effectiveness is about 78% according to Planned Parenthood. And honestly, it can be challenging to pull off, especially in the heat of the moment. We also have what's called pre-cum, or pre-ejaculation. It's a clear, alkaline fluid that comes out before actual ejaculation. The chances of pregnancy from pre-cum are lower compared to full ejaculation, but the risk is still there. Barrier methods. Barrier methods are hormone-free devices or chemicals that help block sperm from reaching the egg. This includes spermicides, male condoms, female or internal condoms, and diaphragms. A spermicide is a special chemical applied into the vagina that kills the sperms at contact. It can be in a lube, gel, or pre-folded film. It's 79 to 86% effective. A male or external condom is a thin pouch that you wear over the penis during sex. It is one of the most popular birth control methods because it helps protect against both unplanned pregnancies and sexually transmitted infections. It's about 87% effective with typical use. To use it, just open the pack carefully so it doesn't tear. Place the condom on the tip of the penis and pinch the tip. This part is where the semen will go. Make sure it's positioned correctly, then roll it down smoothly. If it doesn't roll down easily, it's probably upside down, so just get a new one and try again. After sex, be careful when removing it to avoid any leakage. Then throw it away properly. Meanwhile, female or internal condoms are soft nitrile pouches that you insert into the vagina. Just like male condoms, they work by creating a barrier that helps to block sperm from reaching the egg. Effectiveness of female condoms, 79%. To use it, you gently insert the pouch into the vagina using your fingers, making sure it's positioned properly inside. It should sit comfortably in place and cover the vaginal canal as intended. Then we have diaphragm. It's a shallow, flexible cup made of silicone. You fold it in half and insert it into the vagina so it covers the cervix. It's about 83% effective, and its effectiveness can be improved when used together with the spermicide. Now, there's another barrier method called the cervical cup. It's similar to the diaphragm because it's also inserted into the vagina and placed over the cervix to help block sperm. Its effectiveness is around 71% to 86%, but it's not as readily available in the Philippines. Now, let's move on to hormonal methods. This comes in different forms, sizes, and formulations, but most of them contain estrogen and progestin, which are hormones involved in the menstrual cycle. Here are some hormonal methods you can consider. Birth control sponge. This is a small, round sponge made of soft plastic. It's inserted deep into the vagina with the dimple side facing the cervix. Its effectiveness is about 78 to 86% according to Planned Parenthood. Birth control patch. This is a patch worn on the certain areas of the body and releases hormones through the skin to help prevent pregnancy. You need to change it once a week. It's about 93% effective, especially when used correctly and on schedule. Birth control pills. These are medications that contain hormones. There are two types: combination pills, which contain both estrogen and progestin, and progestin-only pills. You need to take them every day at the same time if possible. The more consistent you are with the schedule, the better the protection. Their effectiveness is about 93% with typical use. Birth control ring. This is a small, flexible ring inserted into the vagina that provides 24/7 protection by releasing hormones into the body. Unlike the previous methods, you don't have to put it out immediately. It can stay in place for 1 month before it needs to be replaced. It's about 93% effective when used correctly and on schedule. Birth control shot, also known as injectables. This method involves receiving an injection of the hormone progestin, and protection lasts for 3 months. It's about 96% effective, and it's convenient since you only need to visit a clinic every 3 months. Now, let's talk about long-acting reversible contraception, or LARC. These are still hormonal methods, but what makes them different is that they are highly effective and you don't have to think about them every day. No daily, weekly, or monthly schedule. You just have to do one procedure and you're covered for years. Under LARC, we have the implant and IUD. The birth control implant is a small, flexible rod that's inserted under the skin of the upper arm. It's about the size of a matchstick, releases a hormone called progestin, and has the efficacy rate of 99%. Some studies suggest it may work longer, but officially, it's designed for 3 years of protection. If you're interested, you just need to set an appointment at a women's health clinic. There's a quick consultation, the procedure itself, and it usually takes around 15 to 20 minutes. You won't really feel the implant once it's placed. The only part that may feel uncomfortable is when you're injected with the anesthesia. After that, you might experience mild bruising or soreness in the area, which is normal. You'll be also advised to keep the arm dry for a few days to help with proper healing. Next is the IUD, or the intrauterine device. It's a small T-shaped device that's inserted into the uterus. Depending on the brand, it can last anywhere up to 3 to 12 years, and its effectiveness is 99%. There are two types of IUD. First is the hormonal IUD. It contains a hormone called progestin, which is similar to the natural hormone progesterone. It releases a low, steady amount of progestin directly inside the uterus. This helps thicken the cervical mucus, making it harder for sperm to reach the egg. The second type is copper IUD. This one does not contain hormones. Instead, it's wrapped in copper, which is toxic to sperm. For the procedure, you'll have an initial consultation first. Sometimes, medication may be given to help soften and open the cervix before insertion. During the procedure, you'll lie on an exam table, similar to a pelvic exam. The provider will gently insert a speculum, clean the area with antiseptic, and then carefully place the IUD through the cervix into the uterus using a thin tube. Once in place, the device opens up and stays securely positioned. Small strings will remain inside the vagina for future removal. After the procedure, you can rest briefly before leaving the clinic. Emergency methods. Now, what if you had sex without using any birth control methods we just discussed? In that case, you can consider emergency contraception. In many countries, this is available as a morning after pill, which should be taken within the 5 days of unprotected sex. However, morning after pills are not currently available in the Philippines. So one option that can be used instead is the USP method. The USP method is about 74% effective when taken within 72 hours after unprotected sex. To use it, take 4 combined birth control pills at once as soon as possible. The pills must contain one of these hormone combinations. First, ethinyl estradiol 30 micrograms and levonorgestrel 150 micrograms. Second, ethinyl estradiol 30 micrograms and levonorgestrel 125 micrograms. And lastly, you may choose in between ethinyl estradiol 30 micrograms and norgestrel 300 micrograms. Then, take another 4 pills 12 hours later. In total, you will take 8 pills, 4 for the first dose and 4 for the second. After completing both doses, no further steps are needed. You can also choose to have a copper IUD inserted within 5 days after unprotected sex as a form of emergency contraception. Permanent methods. Now, if you're leaning toward a child-free life or you already have kids and don't plan to have more, you may consider permanent methods. These are options for people who are certain they no longer want to become pregnant in the future. For female individuals, they can consider sterilization or tubal ligation. This is a surgical procedure where the fallopian tubes are closed, cut, or blocked so that pregnancy can no longer occur. It's about 99% effective. For men, there is vasectomy. It's a simple surgical procedure that blocks the small tubes in the scrotum called the vas deferens, which carries sperm. By blocking these tubes, sperm can no longer mix with semen, preventing pregnancy. There are 2 types of vasectomy procedures, the incision method and the no-scalpel method. It's also 99% effective. Vasectomy is considered a permanent method of birth control. However, in some cases, it can be reversed through a microsurgical procedure that reconnects the vas deferens. Success rates vary depending on several factors and can range from about 60% to 95%. Abstinence and outer course. Now, as you may have noticed, most birth control methods are highly effective, but not 100%. But there's actually 2 methods that can completely prevent pregnancy, and that is abstinence and outer course. Effectiveness of abstinence and outer course is 100%. Abstinence means not having sex. Some people may still choose self-pleasure instead, using their hands or sex toys like vibrators, clit suckers, masturbators, and strokers. Outer course, on the other hand, refers to intimate activities with a partner that do not involve penetration. This could include activities like oral play, hand jobs, and thigh humping. Of course, these experiences are different from penetrative sex, but abstinence and outer course is the only way to completely eliminate the risk of pregnancy and sexually transmitted infections. Finding the right birth control method. Now we're at the final part of this guide, which is choosing the right birth control. There are a few factors you can consider, such as your budget, how easy or low maintenance you want it to be, your future plans. Like, are you thinking about having a baby soon or not for a few years? And honestly, it's your decision. The goal is to choose something you're comfortable with, something you understand, and something you can consistently use. Because birth control works best when it fits your lifestyle. So that ends our guide. We hope you learned something valuable in this episode. If you're interested in exploring the love toys we've mentioned and showed in the video, you can visit www.lauvette.ph or check the shopping platforms linked in the description. Have you tried any of the methods we've mentioned? Share your thoughts or experiences in the comments. We'd love to hear from you. Thanks for tuning into Clitical Thinking. See you on the next one!